Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I'm going to be discussing how you should behave as a PA student during your clinical rotations during your second year of PA school. And the reason why I say this is because I am currently a critical care medicine PA, and where I work, it's an educational institution. So we have a lot of students, residents, people that shadow us, medical students, PA students. So I interact with these students a lot, nurse practitioner students. And one of the things I do have to state, which is one of my pet peeves of whether I have a medical student with me or a PA student, is a lack of interest. So this is why I wanted to make a video about this. And hopefully this video is helpful for you if you are currently in PA school. Since I am a PA, I'm going to gear this more towards PA students. So one of the things I have to say is that I know during PA school, some of the rotations that you'll go through are not something that you're interested in. For example, for me, I was not interested in psychiatry. I was not interested in OB-GYN. Although when I did rotate through my OB-GYN rotation, I ended up loving that rotation. But there were some rotations that I was just not looking forward to because I just didn't want to do it. And in the back of my mind, I said, you know what, I just want to show up, get through the rotation, pass the end of rotation exam, and just get over it, and then on to the next rotation. Is that the mentality you should have? No, it's not, because you learn from every rotation you go through, depending on what you want to pursue. Obviously, if you're going to do psychiatry or something like that, and you go through a critical care medicine rotation, that's not going to be a benefit, but at least try to show some good attitude, some interest, and try to present yourself well, because wherever you go, you're going to make an impression, and the community of medicine is so small is that you can burn bridges really quickly. So that's all I'm going to say about that. So if you're a PA student, and one of my pet peeves, like I said, is these students that we are doing rounds, right? So we're doing rounds, critical care medicine, hospital medicine, you're probably familiar if you've done these rotations, is that during rounds, you round through every patient in the ICU. And so during the rounds, you'll kind of go over your assessment and plan of the patient. And sometimes during these rounds, especially if you are running with your attending physician, it's the best time to get really good education, because your attending physicians will give you really good feedback, and sometimes they'll discuss a topic during rounds. For example, if you are wanting to extubate a patient, basically pull the tube out of a patient that's connected to a ventilator, sometimes they'll bring out during rounds like, what is the criteria for extubating the patient, and why is that criteria used? Well, ground research papers have been used, etc. Why are fluids being given to patients that are hypertensive or have low blood pressure, etc. So it's a great time to learn from the attending physicians, PAs, or other residents or individuals that are there. But if you are rounding, for example, there's been situations where I have medical students that are rounding with me, PA students, NP students, etc., and they are just not interested. And you can tell they're like off to the side, they're on their phone, they're on the computer, they're on their paperwork. It's just one of my biggest pet peeves. So don't be that student. And sometimes the attending physician will be like, where is our student? And I'm having to go look for this student, and I don't know where the student is. They went to the restroom, they left randomly, or I don't know where they went, or they're worried because they're applying for jobs because they know that their job's going to start next year, etc. The applications start, etc. I mean, that is not the time to do it. I know sometimes rounds do last forever. We'll start at 8 a.m. Sometimes they can last to 2, especially if we get interrupted during rounds that a patient's like acutely dying or acutely crashing, etc. But still, like, it's proper to be present during rounds and also be paying attention. So that's my biggest pet peeve, is just not showing interest. Also, you wanting to leave early, that's another really big pet peeve of mine. I know as a student, like, you're trying to study for your exams, etc., but don't ask to leave early. If there's interesting things that are going on, for example, there's a central line, there's going to be an intubation, we're going to ultrasound a patient, etc., then that's something that can be of benefit to you. So don't ask to leave early unless you are released. If I release you and there's nothing going on, like say it's like 2 p.m. and like we have no new admissions, we're full, then yeah, you're more than welcome to go home. But don't ask to leave early. That's like one of my other big pet peeves. Or just sit there and don't ask and act very uninterested and kind of just with your body movements and your body language show that you are not interested and you want to leave. That's another big pet peeve of mine. I think you should show interest in every rotation you go through because you're going to learn something. And like I discussed, the medical community is so small is that these physicians, the attending physicians, me, for example, I will know who you are and I will remember you. And so in the future, if you want to apply, for example, to our program, to critical care, some of my physicians have remembered students that were not stellar during rounds, and definitely they will not help you get a job there. But on the other side, if you are paying attention, you're actively engaged during rounds, you're asking questions, not only to me, but to like the attending physician, or you're actively trying to help, then that's really good. Sometimes there will be times where I'm just so busy. I remember this one time we were in the surgical trauma ICU, and so there was 22 beds. Everyone was out with COVID, so it was just one surgical fellow and me for the 22 beds. So she did 12 and I did 10 beds. So we had to round in all these patients. On top of that, we had to do procedures that needed to be done. We needed to call for any type of consults, write the notes, etc. And it was just so crazy. And I remember I had a medical student and she had a medical student, and that's all we had. And of course, medical students, unfortunately, they can't place any orders or anything like that. They can write notes for you. And so I remember this medical student, she just saw how overwhelmed I was with the number of patients that I had. Because these patients are sick, like they're really sick. Gunshot wounds to the head, like a bunch of abdominal catastrophes, like they're bleeding, etc. And so I remember this medical student just saw how overwhelmed I was. And it was just when I had just first started. And so she told me, she's like, what can I help you with? I can help you with notes. If you want to take half of the patients, I'll take half of the patients. Like I'll present them during rounds. And that way, when I'm presenting, you can put orders in, etc. And when you're presenting, like I can't put in orders, but I can write down on the orders, etc. Because when you're during rounds, you have to present this patient to your attending physician. And it's hard if you're presenting to them, you're talking to them at the same time trying to put orders. So you're the only person who's doing everything. And so I remember she told me, what can I help you with? She was there calling consults for me, placing consults, getting supplies ready for me so I can just go in the room and do these procedures, clean up after me. I mean, she was fantastic. And so I remember at the end of the day, I'm like, I bought her a Starbucks coffee. I'm like, you deserve this. You are fantastic. You helped me so much today. And I remembered her name because she was definitely interested in surgery. So that's an example of just a very fantastic student. So I definitely remember her. I remember her name. If she comes back with us and hopefully gets into the surgical residency that my job has, then she's going to be fantastic. And like I said, she was a great student. And so that's an example of what you should be doing. Be interested, ask questions during rounds. You know, sometimes if we're busy, sometimes it's hard for me to teach you or teach you new things, but if you can help me with small little things, then that's fantastic. So I hope this video was helpful. I just wanted to bring this up. It's just one of my biggest pet peeves. So don't be that student during rounds, guys, or during your rotations. Like I said, maybe definitely I did not like pediatrics, and I know that rotation I really struggled, but I tried to show as much interest as I could. And it actually was useful because the other day, one of my sister-in-law had problems with her child, and I was able to provide her adequate advice. I don't do pediatrics, but just from what I remember during that rotation. And so these rotations are helpful. So show interest, try to learn as much as you can from them. All right, guys, take care. Talk to you later. Bye.